more of our media partners to be present, but you all know that we're continuing to be fluid and in this pandemic situation, so I do appreciate you all being here. I am joined by Dr. Jennifer Avegno, who, as you know, is our Director of Health for the City of New Orleans. Also joined by our Superintendent of the New Orleans Police Department, Sean Ferguson. We're here to pretty much give you an update from our perspective and also call on the public, our residents and our visitors to do the right thing as it relates to covering up, putting that mask on, that face cover, and also as it relates to social distancing or physical distancing, whatever you choose, however you choose to call it. But it's something that we need to have happening right here and right now in the city of New Orleans consistently. Today marks the 12th day of the city of New Orleans moving into phase 2 of our reopening. On yesterday, Orleans Parish had 7,571 cases and 529 deaths in our community. We will have the recent numbers from LDH today at noon. During our stay-at-home mandate in phase 1, our people followed the guidelines. Absolutely. And thank you for getting us to the point where we could move into not only phase 1, but move on into phase 2 with some minimal restrictions still in place. But now, and as we look at the data and we look at what's happening around the state of Louisiana, also seeing New Orleans is we're continuing to hold our own, but at the same time, if we do not double down on our efforts to protect ourselves, the people around us, then we can regress. We do not want to do that. But if the city has to shut down, we will do that without any hesitation at all, because the public health of our people will always be top priority for me as mayor, but for our entire public safety team and health professionals and frontline workers that have led us to where we are right now, making the tough sacrifices to keep our people safe and to flatten the curve again that we have seen, and we've been able to enjoy some level of relaxation because of how we have responded. But recently, again, we have seen this uptick in cases attributed to community spread throughout the state and also throughout the United States of America. On Monday, as you know, Governor Edwards, he mentioned that Louisiana has hit 2 grave milestones, not progress. Over 50,000 cases, we're top 15 in the United States, and over 3,000 deaths. There have been no identifiable clusters of cases related to the recent protests. I can tell you, Dr. Avegno, along with all of our team, are analyzing data and every single positive case that this community receives every single day. And we'll continue to do that because we do not want to go back into community spread. As we move through phase 2, we are seeing, again, calls for concern. Specifically, social gatherings that have, in many ways, been in excess of the 50% capacity of 100 persons, meaning limited to. In addition to that, when you have 100, you really need to have that public safety officer that we say, monitoring the crowds that you may have at your establishments. As we've also seen, people not wearing face coverings. At one point, out and about over the weekend, I was like, okay, wait a minute, our visitors aren't covering up. But then as I moved through the community, I saw, hey, our people aren't covering up either. This is mandatory in the city of New Orleans. Face coverings. It is to protect everyone. We have learned a little bit more about this virus, and we have learned a lot more as it relates to covering up, and the impacts that it has on all of us, positively impacting our ability to not move back into community spread. It matters. While some establishments can open at 50% capacity, gatherings, again, in terms of events, are capped at 100 people. Code enforcement. Listen, we have been ensuring that the level of code enforcement is consistent at every level throughout the city of New Orleans. When we moved into phase 1, as well as into phase 2, but we've had to beef it up even more. And what I mean by that, we've created an official task force that is assembled. It consists of personnel from code enforcement, safety and permits, the health department, alcohol and tobacco control, LDH, the state fire marshal, and a few more. Because enforcement is not only key, it is essential. And we have to act with haste. And it's unfortunate that we have to double down on these efforts, but we're not getting the level of response and respect from the community and our visitors that we desperately need at this time. It's the time right now. We have to double down on our efforts. It is just that important. The consequences for the city, as you all know, large events become super spreaders, regardless if they were intended to from on the front end or not. But it's been demonstrated in our city with facts, with data, with intelligence that lets us know that what we're speaking about, it's real. It's factual information. So this group, in terms of this task force, will be going truly the extra mile of holding people accountable. And this also speaks to our businesses. We have to have it. Some city personnel will transition to weekend shifts to aid in enforcement. Again, people on the front line going the extra mile to ensure that we are safe and protected in our city. It is totally unfair to the people who have been in the trenches for over 3 months, from our public safety team, all while fighting the good fight, have also been impacted by COVID-19. Their families as well, our health care professionals, again, on the front line doing all that's necessary to prevent community spread and getting us out of community spread. In addition to that, saving lives. Now, while we've lost 529 people, 529 people that we've lost in our city in over a couple of months, we have to care. And while we're standing for justice, understand that the people on the front line, they're demonstrating it every single day. This goes to our frontline workers in businesses throughout the city that have allowed us, again, to have some sense of normalcy to where they can serve you, the public. Respect them. They deserve it. And they deserve nothing less. It is critical to communicate the risk that large gatherings have on the public. 80% of the cases are spread by 20% of the infected people. It's a fact. Everyone has a responsibility. And I want to say thank you to our residents who have been doing the right thing. I mean, they have been reaching out also to me, sending me a lot of love, encouragement to all of our folks doing the job. But also, they've seemed to have doubled down on their efforts as well, calling 911 on large gatherings, sending me emails about, Mayor, can you make it mandatory to wear face coverings? When I say it is mandatory. But it is also a continuous struggle and a challenge when we seem to be a little island, not only in the state of Louisiana, but the United States of America. And with a lack of unified leadership. But this is why this city has been so adamant about loosening, not only loosening as we look at what we're going to loosen in regards to restrictions, but being more restrictive, but it's for a reason. We have been disproportionately impacted by COVID-19. You got me all fired up, or maybe I've got myself all fired up. But this is serious. So I'm going to turn it over now to Dr. Avegno to share a few words. You'll hear from our superintendent of police, Sean Ferguson. And of course, I'm going to be right here, not going anywhere. And Dr. Avegno, you know the sanitizer's here. I didn't touch the thing. I'm doing my stuff, but we got to keep it going. And thank you.
We're here to tell you, again, that we are concerned. As you've heard from many sources, cases are on the rise statewide, including in Region 1, which includes New Orleans. We're beginning to see hospitalizations on the rise as well, with a slight decline in our ICU beds. This means that as more people are getting infected, it's translating into more hospitalizations, which is what we are trying to avoid. The R0, which is what I've talked to you about, how quickly a virus spreads in a community, is going in the wrong direction, according to some of our models. This is data set that, as the mayor said, we monitor every day, sometimes every hour, and we are seeing some concerning trends. Some of the most alarming trends are in the breakdown of cases demographically. So the most recent data we have for Region 1 is that 50% of cases, new cases, recent cases, were among people younger than age 30. 10% were kids 18 and younger. This is a huge shift in what we've been seeing. We have not seen these numbers among young people. This is something that is being seen all across the country, and it coincides with further easing of restrictions. In Louisiana, as I think you heard the governor say, 95% of cases are related to community spread. These are not outbreaks at nursing homes. While we do have some nursing home cases, while we do have cases in food processing plants, in other areas of the state, that is the minority. The cases we're seeing now are cases that are spreading through the community, just like in the beginning. As we communicated over the weekend, we have identified clusters of cases related locally to graduation parties and bars at the LSU Tigerland campus. There seems to be either a lack of understanding or a lack of responsibility among many of our young people, and in some cases the parents who are aware of their actions. I am imploring everyone to recognize the duty that you have to all in our community. And as the mayor mentioned, we have been following very closely cases since the protests several weeks ago. With our partners at the Louisiana Department of Health, we have expressed, of course, our public health concerns about being in large gatherings. Again, neither they nor we have identified any clusters related to protests. From my observations, I would say that is a very strong case for the effectiveness of wearing masks, as the vast majority of folks that I saw in those pictures were wearing masks and trying to physical distance. That's true across the country. Across the country in protests where masks were widespread, we are not seeing clusters. So it's very clear where we are and where we're not seeing clusters. If you have participated in high-risk activities in the recent weeks, you should get tested and quarantine yourself. If you went to a wedding where people were not wearing masks and were not staying appropriately distanced apart, if your child went to a party where people were not following the guidelines, if you went to a baseball game and were close to others not wearing masks, or any other situation, particularly those of entertainment or leisure, involving large crowds without distancing and masking, you are at risk. These are high-risk activities, and they are in violation of city and state emergency orders and guidance. You can now contact the Louisiana Department of Health directly if you have tested positive and we're at one of these events, to connect with contact tracers, to receive guidance, and to help them identify others who might have been exposed. I'll give you the number. It's 877-766-2130. Our efforts to contact trace are only as good as the information that you give, or that you pick up the phone when the contact tracers call you. Again, I'm going to reiterate, there is widespread testing available if you feel like you have been exposed or have had a close contact. I am incredibly encouraged by the large numbers of people, physically distanced of course, that have shown up at our testing sites this week. I really appreciate that people are hearing this and are concerned and are taking it seriously. And we welcome you at any of the sites around the city. As we've said over and over again, New Orleans was hit incredibly hard by COVID, but not just in public health terms. Obviously, 529 deaths are devastating, but there is more devastation. Our small businesses, our economy is going through the fight of its life. The vast majority of our businesses are following the guidelines and going above and beyond to reassure customers and their employees to keep everyone safe because they know their survival depends on it. So my real concern now is that we can't go back because of the misguided acts of individuals who participate in uncontrolled gatherings that, as we've seen, can easily spark a huge super spreader event, and that could push us all back. That would be devastating, not only in terms of direct health, but in terms of our local economy, and we cannot do that. Nobody wants to do that. It is not too late. We can continue to hold our own. We can continue to go in a positive direction. What you do today will determine our future, what activities we can do, who has a job to support their family, who lives and who dies. It's very clear. So in the activities you do every day, just ask yourself, am I doing everything I can to keep my family and my community safe? And the answer is simple. It's wearing your mask, physically distancing, not being in large gatherings, and put yourself in harm's way. So thank you.
Thank you, Dr. Avegno. We'll hear from Superintendent Ferguson.
Thank you, Mayor. Thank you, Doc. Good morning, everyone. New Orleans Police Department continues to enforce the requirements of Phase 2 operations and limits on gatherings. We particularly want to ask our establishments, our ABOs, Airbnb owners to be especially vigilant. Last week, we had to enforce our Phase 2 gathering limits on an Airbnb party that was attended by many young people. In doing this, they not only put themselves in danger, they put their family in danger, they put the entire community in danger by possibly taking this virus back to their homes. So if you're planning to have a big party at an Airbnb, or ABO, or your home, wherever, you're going to put everyone at risk, their lives, their health at risk. And we, New Orleans Police Department, would not allow this to occur. We will shut it down and we will hold those accountable. As the mayor mentioned before, there's a task force that has been put together. We will be working diligently with our partners with that task force. But on the other side of that, we are asking you, the community, to show some self-responsibility at this time. We cannot do it alone. This has truly been a partnership throughout this entire process. Over the last several months, we were able to get over the curve. We need to continue to do just that. We're also asking the public to remember, contact sports are not permitted. Contact sports include football, basketball, soccer, just to name a few. But any sport in which there's continuous body contact without social distancing, we are not allowing that, and we're asking you to please not engage in that. We're not there yet, and we need to be just a little bit more patient. I would like to thank those in the community who have been responsible, who have been cooperating and working with everyone in our city government to make sure that this community, this city, this state can get through this together. Residents, should you see any large gatherings, we ask that you contact us through 311 or NOLA311.org to make any complaints. New Orleans Police Department continues to give warnings whenever possible, but our level of enforcement when engaging crowds will continue to depend on the citizens' behavior. In partnership with the mayor's office, in partnership with Homeland Security, all 8 of our districts issued out masks on last week, and our officers while on patrol will continue to have masks to help stop the spread. So please, as long as the supplies last, we will have that to help assist as best as we can with that, while also enforcing the parties at home, the parties at the ABOs, the parties at the Airbnbs. Again, this is very serious. We cannot emphasize enough how important it is to wear your mask, including ourselves. Our officers should be wearing their masks as well to help protect the entire public from this spread. Practice social distancing, and please avoid large gatherings. And together, we will get through this. Thank you, Mayor.
Thank you, Chief. Thank you so much. So that really concludes our message this morning. And of course, like always, we will take questions as they come.
The advocate?
So several questions about the recent gatherings. One, are any actions being taken against Felix's Chop House or the organizers of the event on Barone? Can you identify who was organizing the Newman events, and will any actions be taken against them?
No,
Why
I'm not, well, in terms of, all of these matters are under investigation and steps have been taken in that regard. Chief, you want to share anything right now, or they're all under
No, that's it,
investigation?
I mean, it's it. They're all under investigation, not just on the criminal side of it, as well as on the administrative side of this. So, we're taking a holistic approach in addressing this matter, with our partners, as we said before, with safety and permits as well, and as well as alcohol and tobacco. So it is a holistic approach, but we want to identify the appropriate action moving forward, but an action that is meaningful to let everyone know that this will not be tolerated.
And it has to be across the board.
Across the board.
We don't need to know who you are, what your establishment is. If you're wrong, you're wrong.
And just to be clear, I mean, early on in this, there were several events where people got ticketed or arrested for organizing them. That happened fairly quickly. Why, what's going on with the investigation right now? And is that
It's
a
ongoing,
possibility on this?
absolutely. That's why it's under investigation. Because so many were involved, but you want to make sure that you're just in your actions.
Mhm.
And that's why we take it not only very seriously, but doubling down even on the efforts to ensure, again, that we are transparent in regards to the investigation, but at the same time that it's just and it's fair.
Do you guys know who the organizer?
I'm not gonna give you a name, so don't ask me that. I'm not gonna do that, not now, because we want to make sure that when we speak, correctly about it.
I'd say 26.
So the city is considering shutting down businesses that are not following COVID-19 guidelines.
Absolutely, the city has taken action against multiple businesses, but there are many also that are under investigation right now, those that you don't even know about. But that's why this task force was assembled, so that we can be very comprehensive in our approach, because I want swift action. Accountability has to be swift, and it has to be consistent. And that's what we're about within our administration. So this task force, I mean, they're going out, like I said, I have employees adjusting their schedules to work over the weekend. And this will be ongoing until we get a handle on people being in compliance or businesses in compliance.
Okay. Now, to talk about contact tracing, okay. How many contact traces are there in Louisiana and in the city, and how do we get that type of information?
Sure. The contact tracers are organized through LDH at the state level. And so there are multiple, I know in terms of statewide, But I'll have Dr. Avegno kind of give you a little bit more information, if possible, on the process.
Okay.
Yeah, thank you. The latest updates that I have is that the state is very close to hitting the 700 contact tracer target. That was their target for the number of contact tracers they wanted to hire. Last I heard, there were at least 600. And they're divided by regions. And I know at least 100 are working on Region 1. I'm sorry, I don't have the exact numbers for you. Contact tracing here, like everywhere in the country, is a challenge. There are some significant challenges to it. Number one, standing up a system in a matter of weeks that has to be very comprehensive, and you know, contact tracing is not something that anybody can just walk into a job and do. There's a lot of training that's gone on, which they have all received, but it is a difficult job. It's made it more difficult when folks don't pick up the phone. That's why they came out and offered the phone number that I gave you earlier, so that people can call them, maybe thinking that might be easier for some people. And their job is also challenged if folks don't really provide the information that's critical going forward. So I'll say that they are working through those, just like contact tracing all over the country. The other thing to remember, if 95% of our cases are community spread statewide, if you remember in the very beginning of this, when we realized very quickly we were in community spread, that is the hardest thing to trace, because that means that you're not quite sure where you might have gotten it from. Maybe it was the party that you went to one day, or maybe it was the gathering that you went to 3 days later. And so it becomes very, very tricky. So again, the more we can control this so that it's just a isolated outbreak here or there, the better contact tracing is going to go.
Okay. Thank you.
WWL.
Could you talk a little bit more about the task force? How many people are going to be on it? Are they going to be doing inspections? Are they going to be able to do the enforcement instead of the NOPD? Will they have citation powers?
They already have citation powers. It's code enforcement. It's safety and permits. It's alcohol and tobacco control. So we have enforcement powers that are separate even from that of the New Orleans Police Department. It is a unified command. They will be doing inspections. They will be giving citations. They will be moving forward, closing businesses down if they do not comply. So in terms of the actual number of my staff members that are assigned to this, I'll get that to you. It's many. It's many. And even to where, again, where we are, in terms of their schedule, changing their schedule to have more of access on the ground on the weekends, because that's when things really seem to go on an uptick. And so we're modifying the schedules to be more accommodating as possible, so that we can be swift in action towards accountability.
If short-term rentals remain a problem, will you look at possibly outlawing short-term rentals?
No, we're going to deal with the bad actors. Because if that's the case, if one business acts up, then you close them all? No. You deal with those who are not in compliance. And we'll be swift in our actions. But no, we will adhere to the law, meaning in terms of permitted short-term rentals, and we will hold them accountable as it relates to their actions and activity in this city. So where you have the one that was identified, they're being dealt with. But I'm not going to penalize everyone because of one bad actor or two bad actors. It's not fair.
WDSU.
So what happens when someone reports a large gathering on private property? Is there a difference?
No. No, it's not. A business is private property. A home is as well. The thing is when you're not in compliance, it can lead to community spread. And that's what we are really trying to prevent. We have been there before. We can go back there again. And if we do not practice personal responsibility and adhere to the mandates that are tied to this emergency declaration, we can go back. That's why this is so serious. And we've worked hard to get where we are. You know, and it may be a little bit easy for someone who hasn't leaned in a little bit harder, as much as all of our folks have. Again, public safety team, frontline workers, healthcare professionals, bus drivers. Everybody has been leaning in, doing what it takes to keep this city rolling. And it's not fair for the people who have been relentless, who have not wavered. But we're human too.
How close are we to going backwards to phase one?
Well, right now, this city, we're in a place where we can continue to make progress. And we want to stay on that path, that track of progression. But every day matters. Every day matters. So we're not there yet. We don't want to be there. That's the whole point.
Yeah.
Earlier in the process, y'all had set a goal or a trigger of 50 cases per day. I think it was a 5-day rolling average for reenacting restrictions. Is that still the trigger? And is there a specific set of restrictions?
There are multiple, and I'll have Dr. Avegno speak to that, and it's also including the R not, but I'll have her talk about it.
Yeah, Jeff, thanks for bringing that up. The metrics that we said in the beginning are still the ones that we continue to look for, and that is one of them. The number of cases per day, hospitalizations, and we're looking at other things like the percent positive test, the number of testing, right? I'm happy to say that yes, we still are below that 50 threshold. And just going above that 50 threshold would not necessarily mean we went back, but it would be a very, very bad sign. We're looking very closely at the day-to-day case numbers and the 5-day averages. It's been a little tricky in the last week, as many of you know, because the state has been doing some internal data cleaning, so the numbers are a bit all over the place. I'll say though, there were a couple of weeks ago, we had several days where we were in single digits for cases. Those were really good days. We're now routinely 20, 30, even 40. So, again, we've always said we're not going to put too much stock into one day, but we are really watching closely how those numbers track, and we're going to continue to watch closely. And again, as the mayor said, we are doing really well. If you look at Jefferson Parish yesterday, they had 4 times the number of cases that we do. We know that inevitably will affect us. So as we've always done, we err on the side of caution and we proceed very carefully. What's happening in many other parts of the state is really quite alarming in the number of their rise. And so we are hoping, that's why we really do need everybody to double down so we can maintain the excellent progress we've made, even if those around us are not having the same success.
Sorry, are there specific, if the city were to start adding restrictions back, is there sort of a specific order in which those would happen? Would it be a full rollback to phase 1? Would it be, we'll try this and then how would that work?
I think you have to target, and again, the mayor obviously is the ultimate authority, but I think you really want to target why are we coming back. So right now, we know that the clusters that we're seeing are from very specific types of events, from large gatherings. That's why we're really, really hammering home the messaging about large gatherings, right? We're not seeing clusters from people going to retail stores, right? Or even sitting at a restaurant and, following all the guidelines, right? So we would hope that if it's really clear why our numbers are going up, then we could focus on whatever that is that's making them go up, and if additional restrictions, apply it only to those. We don't want to go back. We don't want to go back to a blanket, phase 1. That would be devastating. And so, we hope that if we do have to do anything, it'll be just targeted precisely. But that's really depends on all of us.
Any other questions pertaining to COVID-19? Madam Mayor, State has something off topic.
Oh, okay.
We've been receiving a lot of phone calls about citizens not having their garbage picked up. What's the latest on the sanitation department?
Oh, Lord have mercy, and it's not the sanitation department, it is our contractors who have a contract to collect garbage throughout the city of New Orleans. But clearly I understand, when the garbage isn't picked up, hello, city of New Orleans, we are responsible for that, taking it extremely serious. I do have my Deputy CEO of Infrastructure, Ramsey Green, who is with me now, and I want Ramsey to speak to that. This is a daily conversation, multiple challenges.
Thanks, Mayor. We're very well aware of it. What we would urge every citizen to do is, if your trash isn't picked up on the day that you expect it to be taken, call 311 and report it. The best way that the city monitors its contract is through daily 311 calls. And if a 24-hour period goes by and the trash isn't picked up, that is our leverage with our contractors. We are starting to implement that now with all of the contractors. I'm not going to say every contractor is as bad as one versus the other, but I can tell you that we have had some really responsive changes made in sanitation pickup, particularly in the French Quarter. And then we have some other challenges related to labor issues on the contractor side as well. Our team, our in-house sanitation team, as the mayor said, manages external contractors, and we're working very aggressively to get these things fixed. And just the best thing a citizen can do is call 311 and report that their trash has not been picked up if it hasn't. Thank you, Mayor.
Yep, that goes for my street too.
Any other questions?
Anything else? Well, hearing nothing else, thank you again for your time. And, you know, I just ask you to bear with me. Very passionate about this because this is serious. This is about lives in the city of New Orleans. So thank you again for your time.